Okay, so today is the 25th, and I went on my patient portal today and I saw that the surgery visit, which was scheduled for the 12th, is no longer scheduled at all. However, all the follow-up stuff, pre-surgical stuff is still scheduled, so I don't understand. I called the nurse practitioner who's the one in charge of my case. I guess I'm not really sure what her job is. And she never called me back. Hopefully she'll call tomorrow, but she's been away on vacation and I haven't spoken to her about once. She did call me once to give me the results of the biopsy, but then she called me once when I asked the doctor to please have a call, but she never calls me. Like, I leave her messages on that portal. I've left her 4 messages. I haven't heard from her since. So, but hopefully she'll call me. This is Memorial Sloan Kettering, and I would have expected, a little better response from a place like that, but who knows? I have so many questions and really don't have anybody to ask. There's nobody, there's nobody to ask anything. You have 5 minutes with the surgeon, and they ask you a million questions, but you can't ask them anything, or it doesn't feel like you can. At least nobody says, do you have any questions? And you just say, okay, we need this, and this, and we're going to do this, and this. But they don't say anything else, like how you feeling or anything like that. I don't know, maybe I'm thinking that maybe they think this is just a routine, run-of-the-mill thing, but not to me. It's not that way to me. I guess if you do something 1,000 times, it wears off that, it wears off on you that you're not, you just, like, I guess that happens pretty much in every profession. It's new when you have new clients or new patients. You forget, and you just go through your routine, and that's what it feels like. They're just going through a routine, and I have there's no personalization, there's no nothing yet. Maybe that'll come at some point, but right now it's just been very, almost like you're in an assembly line. You gotta go, wait for a call for an appointment, schedule the appointment, go for the biopsy, that's the first appointment, then go for another biopsy, then talk to the surgeon, then talk to the gene people, the geneticists. Then they call you for taking the blood work for the geneticist, then doing the MRI. Then it's like you're seeing a million different people, and it's robotic, and you're in this assembly line, and there's no personalization whatsoever. that I've detected. I don't know if it's just my team or me. I would have expected more from the second highest rated cancer center in the country and possibly the world than this assembly line type of feeling. So my next step is tomorrow. I'm gonna have a telehealth call with the geneticist, or I don't know what she is. She's some kind of doctor, but I'm thinking it's probably geneticist because it's all about the gene therapy that they have to do. And then they're coming to fix my refrigerator, which broke. Brand new $2,000 refrigerator. Broke twice in 7 weeks. I hope they give me a new one or give me my money back. Then Wednesday I have to go to the dentist. It sort of seems so silly to go to the dentist when you have breast cancer, but I have to go to the dentist. So I'm going to the dentist, and then I have 3 appointments with Sloan Kettering on Thursday. The MRI, the blood work that they have to take for the gene thing, and then the heck is the other thing? I forget. But there's 3 things, and then wait for the results. I have to wait for the results. And then I guess somebody's going to call me and talk to me about what kind of surgery they're going to recommend. So that's got to happen before the 12th. And we're running out of time a little bit. I don't know how long it takes to get the gene results. And then I have no idea how long it takes to get the MRI results, but I would imagine that would be pretty fast, because usually it's pretty fast. I'm not going to look at the results on my portal because that's scares me, and I want to be as happy as long as I can. So until they call me and tell me what did they say, I'm not going to look. Yes, God. Sorry. Yep, so that's about it. So say a prayer that my refrigerator gets fixed tomorrow. I've had this happen twice, and I probably have lost $1,000 worth of meat and fish that just defrosted. It's not, and I paid so much for the refrigerator. It's unbelievable. This is an LG refrigerator. So don't buy one if you're in the market for an LG refrigerator. Guess I just got a lemon. I got this terrible lemon refrigerator. Compressor broke again. Now it's turning itself off and on. No, pattern to it at all. It just, when it feels like stopping, it stops, and everything defrosts. Then it goes back on, but usually just the refrigerator, sometimes both, but then it'll go off again. I should check it now, as a matter of fact. Anyway, so I'm going to sign off. It's 1 o'clock in the morning. So actually today is the 26th, not the 25th. All right. Talk to you all soon. Bye.